Hello and welcome to the live session on management of triple negative breast cancer. I'm your host, Dr. Sushila, and I'm delighted to have with us today Dr. Rishikesh Kumar, Consultant Medical Oncology, Indraprastha Apollo Hospitals, Delhi. Dr. Rishikesh is the winner of the Best Clinical Investigator Award and a cancer specialist who treats all types of cancers. We also have a very special guest today, Ms. Priyanka Sharma. Ms. Priyanka is a breast cancer winner who has kindly agreed to share her experience and motivate others who may be traversing through this journey. आज हम बात करेंगे स्तन कैंसर के बारे में। कुछ ऐसे अहम मुद्दों पे बात करेंगे जो कि पेशेंट्स को अफेक्ट करती है, सच एज कि क्या मुझे सोसाइटी एक्सेप्ट करेगी। So let me begin with the first question addressed to Dr. Rishikesh. How common is breast cancer in young women? Is there an increase in its incidence recently, Dr. Rishikesh?
Namaskar, Sushila ji, and also very welcome to Ms. Priyanka. ये बहुत इम्पोर्टेंट बात है कि यंग वुमेन में कैंसर्स के नंबर्स में ज़्यादा देखने को मिल रहे हैं. Of course, the incidence has increased in recent times, and it has many things related with it. However, at least 5% of the patients which we see nowadays in clinic, or more than 5%, are young women. So this is very important and very crucial information, because they have long life ahead to spend and achieve. So that's very important. And as per the risk category, this becomes one of the very aggressive cancer if it comes into the young woman.
Next question is for you, Priyanka. After you were diagnosed with breast cancer, which must have been quite a shock for you and your family, what were the initial problems जो आपने face करी?
Ma'am, the initial problem was very first problem is acceptance of the diagnosis that I faced. Then finding the right center and the right doctor to not treat the ailment, but to handle the situation and the patient simultaneously. That was the biggest challenge, and I struggled a lot for this. I struggled first finding the right center and getting into this. So I came to Dr. Rishikesh when my treatment was already, it was ongoing somewhere, and I was not happy with the procedures. So after diagnosis, the very first thing is I would recommend to anyone, you need a good doctor who can consult you about all the effects and side effects of the treatment, procedure, and how your life will be after this diagnosis.
Sure. So coming to you, doctor, what is the role of genetics in cancer management? How did genetic testing affect the treatment plan in Priyanka's case? And after understanding her disease, how did you plan her treatment regimen?
Very important questions here. सबसे महत्वपूर्ण बात है कि breast cancer होते हैं, of course, and with time the chance of having breast cancer increases. बट किसी महिला में अगर कुछ जेनेटिक कमी है, जैसे एक म्यूटेशन है, तो नॉर्मल जीन के जगह एक एबनॉर्मल जीन है, तो ब्रेस्ट कैंसर के चांस बढ़ जाते हैं. जिसमें से सबसे कॉमन जो हम बात करते हैं वो है ब्रेस्ट कैंसर जीन, नाम ही है इसका, BRCA1 and BRCA2. So it increases the chance of developing breast cancer to almost 70%. So from like 5 to 10%, it goes to 70%. So you know that it's quite a big number when you have a very high chance of developing cancer. ऐसे केसेस में वंशानुगत है और साथ में म्यूटेशंस कुछ बॉडी में होते हैं, इन दोनों की मिलीजुली प्रक्रिया है. बट सबसे जो इम्पोर्टेंट बात है कि इस म्यूटेशन अगर यंग पेशेंट में खास करके ट्रिपल नेगेटिव ब्रेस्ट कैंसर हमें हिस्टोपैथोलॉजी में बायोप्सी में मिलते हैं, तो हम ऐसे भी, और अगर ट्रिपल नेगेटिव मिलते हैं तो और ज़्यादा म्यूटेशन टेस्टिंग करते हैं. अगर म्यूटेशन टेस्टिंग पॉजिटिव आती है, जैसे प्रियंका के केस में BRCA जीन म्यूटेशन पॉजिटिव था, तो हमें अपना रास्ता थोड़ा सा पहले से तैयार करना पड़ता है. और ऐसे कैंसर्स कीमोथेरेपी को वेरी गुड रिस्पांस देते हैं और उसके बाद हम सर्जरी के लिए जाते हैं. कीमोथेरेपी से अच्छा रिस्पांस मिलना ये भी बताता है कि पेशेंट का वापस ब्रेस्ट कैंसर को वापस आने का चांस कम है, ये कंपेयर टू दोज पेशेंट जिसमें कीमोथेरेपी से पेशेंट के कैंसर रिस्पॉन्ड नहीं करते हैं। तो प्रियंका के केस में कैंसर ने अच्छा रिस्पांस दिखाया कीमोथेरेपी के दौरान। उसके बाद हम सर्जरी के लिए, जो एक प्लान्ड ट्रीटमेंट है ब्रेस्ट कैंसर में, यू टू गो फॉर सर्जरी। सो मोस्टली यू गो फॉर ब्रेस्ट कंजर्वेशन सर्जरी, अगर आप ब्रेस्ट को बचा सकते हैं और ट्यूमर को निकाल सकते हैं। बट समटाइम्स इट इज नॉट द राइट चॉइस, स्पेशली इन केस ऑफ प्रियंका। तो उनके केस में सर्जरी थोड़ी डिफरेंट हुई, कुछ हम लोग आगे बात करेंगे। और आगे का काम है रेडिएशन की जरूरत है कि नहीं, तो प्रियंका के केस में जरूरत नहीं। तो आगे आप बताएं।
Right. Thank you, Dr. Rishikesh. That was really lucid. So, Priyanka, getting into a long journey of chemotherapy is quite a tough experience. However, in case due to a genetic mutation, you were counseled that you would need removal of both the breasts as well as ovaries, and this would be preceded by chemotherapy. So, ये काफी tough choice रहा होगा for you. How did you react to this?
For initial 2 months of my chemotherapy, I was completely shattered, and that's how when I met Dr. Rishikesh, and I remember I came to him for a second opinion, but his expertise changed my entire cancer journey altogether. That's the biggest thing. A doctor plays the important role. Yes, it was a tough decision, but Dr. Rishikesh helped me. He said, let's focus on one thing first. We will focus on chemotherapy and its results. Surgery is an important part, but we look forward to it. So he didn't give me the pressure of breast removal and ovary removal at the time of third or fourth chemotherapy. So he prepared me step by step. So first of all, and in that case also, I had a lot of side effects, and I was frightened of chemotherapy. मुझे इतनी एंजाइटी हो जाती थी, मुझे रात को नींद नहीं आती थी कीमो से पहले। So उस डर को उन्होंने निकाला। He used to meet me before chemo sessions, and क्यों वॉमिट हो रहा है, वॉमिट का कोई चांस है ही नहीं, we are not giving you any medicine, you're absolutely fine. So he gave me that set of confidence that you're fine, you're recovering. That shows a very nice improvement. The tumor showed regression. Then I stopped getting being anxious or vomiting. He get me out from that fear zone of chemotherapy, and he normalized me first. Then we moved towards the surgical aspect, and he didn't bombarded me with the choice of the surgery and the surgical intervention. He gave me time to deal with that grief first of all, of getting from chemo, losing hair, losing body appetite. He gave me that buffer.
Yeah. Sure. But as I said, I mean, undergoing such a massive surgery must definitely have been tough. What was the reaction of your family?
Reaction, to be honest, Dr. Sushila, we didn't get time to react. Everything was so quick. When we were sitting on the treatment planning discussion, I remember previously we had planned something like I was little body conscious. I'll be honest about it. As a woman, as a young woman, I was very conscious about my body image, everything. And we were discussing on the treatment planning, and I remember my husband was sitting there, and we were discussing the reconstruction. And when the doctor explained us that 11 hours, 12 hours will be the surgery, my husband's first reaction was like, I won't allow you to go through this. ऐसे क्या हो जाएगा? He was completely he was shocked with the treatment planning itself. And my son, I had a 9-year-old son, so he was little that he really assured me, don't worry, I will stop loving you, Mama. You will be same with me. Don't worry, you will be absolutely safe. You will be alive. You will be with us. The biggest support in this, I would say, was my father, because my grandmother had breast cancer. So my father was the biggest force. Tell me, go forward to single, double mastectomy. I want you to live. My mother was because my grandmother was stubborn not to get a mastectomy. That cost her life. And my father was of the similar age which my son is today. So he really,
Stood.
prepared me for this.
Yes. So, Dr. Rishikesh, what difference can a doctor make when such decisions need to be taken?
Very important. Of course, anyone diagnosed with cancer, the sky falls. So it happens, and it is acceptable and normal reaction to this kind of diagnosis. I understand that you might have witnessed someone undergoing this kind of treatment, and then you have some idea. But especially when it falls on you, then the world changes definitely for you. तो प्रियंका के केस में भी यही हुआ था. ट्रीटमेंट कहीं शुरू हुई थी, लेकिन ये काफी परेशान थी. तो फिर जब हमारे पास आई थी, हमने प्लान किया वन आफ्टर द अदर ट्रीटमेंट के जो स्टेप्स हैं वो हम करते गए. इसमें जो सबसे इम्पोर्टेंट चीज थी कि कीमोथेरेपी और सर्जरी तो है, लेकिन जो मेन बात है कि वो है रिस्क रिडक्शन प्रोसेस. क्या है कि आगे प्रियंका को ब्रेस्ट में कैंसर ना हो या और कोई ऐसा ऑर्गन जो कैंसर ना आए, उससे बचने के लिए प्रियंका को क्या स्टेप्स लेने पड़ेंगे, डॉक्टर्स उनके साथ कैसे काम करें. इसमें जो सबसे इम्पोर्टेंट चीज है कि आफ्टर शी अंडरगोज सर्जरी, अगर गई होती वैसी सर्जरी में ब्रेस्ट ना सिर्फ ट्यूमर निकाला जाता, तो every 10 years almost chance of having new breast cancer would have been like 10 to 20%, जो कि आगे बढ़ते बढ़ते 40, अभी 30 के हैं और 70 साल तक में जाके कई गुने बढ़ जाएंगे. तो दूसरी बात ये होती है ऐसे कंडीशन में कि अगर ब्रेस्ट कैंसर आता है तो आप श्योर नहीं कि वो ब्रेस्ट में ही आएगी. एक रिकरेंस जो होगा एक ब्रेस्ट में आके साथ में कहीं और भी आ सकता है और आपने डिटेक्ट नहीं कर पाए, तो यू बिकम स्टेज 4 स्ट्रेट अवे एंड देन लाइफ इज लाइक लिमिटेड, स्पेशली इन ट्रिपल नेगेटिव. सर्वाइवल अच्छा नहीं है. ऐसे केसेस में हमें ऐसे डिसीजन लेने पड़ते हैं कि पहले जो ग्राउंड है जहाँ कैंसर बन सकते हैं हम उनको हटाने की कोशिश करें. सो आफ्टर इंस्पायरिंग स्टोरी ऑफ द हॉलीवुड स्टार एंजेलिना जोली, this was acceptance of this kind of treatment increased worldwide. And प्रियंका को भी जो ऑफर किया था आफ्टर इनिशियल हिकअप्स और सोच समझने के बाद, this couple was ready to undergo the procedure so that at least फिर से पूरी कीमोथेरेपी और सर्जरी की प्रक्रिया को जिंदगी में नहीं दोहरानी पड़ी. लेकिन जो दूसरी इम्पोर्टेंट बात थी वो है ओवरी में भी ब्रेस्ट कैंसर के चांस BRCA म्यूटेशन के बाद बढ़ जाते हैं, इसलिए हमें उसको भी ध्यान रखना पड़ता है. ब्रेस्ट में तो आप स्क्रीन भी कर सकते हैं MRI करके, जो कि अप्रूव्ड एक मेथड है चेक करने के लिए, लेकिन ओवरी में कोई अप्रूव्ड मेथड नहीं है जिसको कि ओवरियन कैंसर को आप स्क्रीन कर सकें और उससे टाइम रहते हुए उसको निकाल दें और बच जाए. तो ओवरी कैंसर आपको जब पता चलेगा ऑलरेडी ये फैल चुका है, स्टेज 3 हो चुका है, ऐसे कंडीशन में हमें दोनों ऑर्गन्स को सेक्रीफाइस करना पड़ता है. Unfortunately, after counseling, and Priyanka is very confident and forward-looking woman, so she agreed for the treatment. And after the process of we underwent through a process of describing her with the multidisciplinary team how we are going to manage your case, especially for the surgery. तो एग्री हुई, बट बाद में इनको लगा कि ब्रेस्ट रिकंस्ट्रक्शन अभी हम डिले करें. दैट वाज अ वेरी गुड चॉइस, नाइस चॉइस. So she delayed the breast reconstruction, and right now she is just on follow-up and doing well.
Great. So Priyanka, you chose to undergo, wait for the breast reconstruction, basically. Again, a tough decision. And I'm sure Dr. Rishikesh guided you. Could you also let us know how he guided you to take this kind of a decision?
Yeah, first of all, he didn't directly talk to me. He didn't discuss with me, first of all. He discussed with my husband. And I was very adamant at that point of time about my body image. And obviously I was in chemo. I was not able to think straight because everything was falling on my head. So he gave me time. Then he called me after 1 week after the treatment planning, and he discussed with me as well. My husband told me that this is what Dr. Rishikesh told my husband was that recovery will be delayed. So what you are taking a decision of both mastectomy, bilateral mastectomy, and for a longer life, for a healthier life, and a better quality of life. So quality of life won't be the same. You have 70 stitches, then you'll have stitches at the back. how will you work, and how you're working also, you're a mother also. So you need a better quality of life with a longevity as well. So that's how he counseled my husband first. Then he spoke to me, and then he asked me that, see, I know you that you're not able to bear pain on an intravenous injection. How do you bear such high pain on both the sides and the stitches? Which again, he was right. He have seen me in OPD, he have seen me while chemotherapy sessions. So he have precisely tailor made everything for me. So, and I really appreciate him for that as well. I was discharged 2 days after mastectomy. I was able to walk. Okay, the drains were there. Then the drains were removed after 15 days. I started my job 3 months after the surgery, where the quality of life is much better.
Great. Yeah. As we have understood, certain genetic mutations require that we need to undergo these kind of surgeries. While in some cases we offer a breast conservative surgery, in your case we took the road of a double mastectomy as well as removal of ovaries. So, Dr. Rishikesh, why is removal of ovaries important in such cases?
Yeah, so like BRCA mutation, the gene which is mutated, actually it is a defender of your body in a way, because it repairs the mutation. Whenever there is an ongoing mutation in the body and few mutations which remain unchecked, if it is not corrected, can create cancer. So BRCA is basically, BRCA gene is basically, it stops and it repairs the mutation. So the body is working without cancer, you're just going well. However, if BRCA is in itself deficient or not working, so who is going to defend you from the cancer? That's why you develop cancer. And with the BRCA mutation 1 and BRCA 2, there are two known genes important here. Chance of ovarian cancer also increases. So it is increases from range of 60% to 80-90%. Now, ovary is located inside the abdomen, in the pelvis, and you won't be able to see the changes going on there. So that's why, as a risk-reducing surgery, you have to remove the ovaries and the fallopian. And along with that, it's very important to understand, if you remove ovary and the tubes, it has an impact on the reduction in the chances of developing breast cancer also. So even if a patient is only doing ovarian removal, oophorectomy, that is also a bearing on the reduction in the number of cases or the chance of developing a breast cancer. So in both ways, it is very important. You are reducing the chance of recurrence of new cancer in ovary, and you are also reducing the impact it could have on the breast cancer. So it was a very good choice to make, and usually risk-reducing surgery in cases of BRCA, the two important organs, the breast and ovary, sacrifices are important.
Thank you. But then, surgery like this, post-menopausal symptoms are inevitable. हमने इस चीज का कैसे ध्यान रखा, पेशेंट का कैसे ध्यान रखा, उनको कैसे हेल्प किया to overcome these symptoms?
Yes, बहुत महत्वपूर्ण बात है ये, क्योंकि 30 के एज में पोस्ट-मेनोपॉजल सिम्टम्स जो 50s में आते हैं वो आ जाना, बट फॉर्चुनेटली हमारे पास मेडिसिन अवेलेबल हैं, जिसको प्रियंका को हमने स्टार्ट किया. एंड इनिशियली व्हेन शी वाज नॉट इन मेडिसिन, बिकॉज मैं वेट कर रहा था थोड़ा ताकि मैं स्टार्ट करूं, एंड नाउ शी इज ऑन सॉर्ट ऑफ हार्मोन रिप्लेसमेंट थेरेपी. हार्मोन रिप्लेसमेंट थेरेपी इन जनरल नाउ इट इज डिस्करेज्ड बिकॉज द ब्रेस्ट कैंसर के चांस बढ़ते हैं. लेकिन प्रियंका के केस में क्योंकि एक तो ट्रिपल नेगेटिव ब्रेस्ट कैंसर था, दूसरे हमने ब्रेस्ट टिश्यू को रिमूव कर दिए हैं, so chance of developing breast cancer because of hormone replacement therapy is almost negligible, and that's why we could fortunately start on a hormone replacement. ये tablet daily एक लेना पड़ता है, but with that she is having good, especially skin quality and other related issues are under control, and she is doing well. She is now she has started working, she is enjoying her office.
Amazing. So, glad to know that we have so many treatment available, so many types of treatment available to handle every kind of situation, basically. And to Priyanka, this is my question to you. What message do you want to give And what kind of to people, to society in general, what would you like to tell after going through this kind of an experience?
See, the only message I would like to say that you should be a little sensitive because what I faced, yes, cancer is a very tough disease, but the kind of myths that are related to cancer, see, every disease is not metastasized cancer, and अगर आपको कैंसर हो गया है तो आप आनंद पिक्चर की राजेश खन्ना की तरह मर नहीं जाओगे। ये बहुत हमारी सोसाइटी में एक मिथ है कि जो मूवीज में दिखाते हैं कैंसर हो गया, like every second person is like, okay, it's a death sentence.
Yeah.
I face a lot of things. My relatives said to me कि मरने के लिए तैयार हो जाओ, कोई बोलने लग जाता है आप अपने कर्म भुगत रहे हो. So there's a lot of things, but you have to be strong. Then you should have a good doctor with you who could listen to you and help you not only sell the disease but prepare you mentally for all the challenges. If I'll say in my case, chemotherapy stopped in December, so the surgery, Dr. Rishikesh didn't, he didn't leave me. Even before surgery, when I was nervous, I was anxious, he was the one who said, don't worry, relax, everything will be fine. Prior to surgery, he met me, I have any issue, he's there to listen. There is a lot of, if I say society में तो people are not accepting the fact, okay, breast removal, menopausal symptoms, it's very difficult to deal with them. Even your relatives won't spare you. I had many incidences, and when I came for a consultation with him, he'll hear those and he'll understand that, okay, what will be the impact of that one sentence on me. Like a few days back, someone said to me in office that, अरे आपके organs निकल गए, आप जिंदा कैसे हो, आप चल कैसे रहे हो, आप. To be honest, it was very offensive to me. But I know people don't know anything about, so what we can do? We can only smile and sail through it. And my message to the world is that it is curable. We have to be strong enough, and there should be a good practitioner with you. In my case, Dr. Rishikesh he's good with research and he's very good with the counseling part. So from third chemo, where I was not able to stand, after fourth or fifth chemo, he got me so strong that I remember shopping myself at Lajpat Nagar. And I was feeling so empowered कि मैं उठ नहीं पा रही थी 2 महीने से, अब मैं अकेले जाकर शॉपिंग करके आई हूँ अपने घर में शॉपिंग. It was for me, it was very empowering. So these small, and one more thing, he never discouraged me. Like you'll see hospitals, you'll see cancer centers, you'll see a lot of negativity. Okay, we don't have hair, we can't walk much, appetite problem hai. But I used to always dress up properly and always wear a smile. So he never discouraged me he always encouraged me on that part. It's a good part. कि आप हमेशा वो मतलब मैं कभी.
So basically, you would like that people should be more sensitive towards the condition, and there should be encouragement to face it rather than being negative and talking in a negative way. And of course, having a doctor who is so supportive and kind really helps. So, Dr. Rishikesh, last question to you as we are moving on to the end of the session. What message would you like to give to cancer patients and society?
The important thing is the cancer is here, it will remain. I mean, we have actually, the disease is a price you pay for a life. So if it has to come, let us face it and let us fight it together and help those, and at least not financially, not other way, but at least with the words, help those who are fighting, those who are suffering, and that makes a lot of difference. We have to be educated and well-behaved society. Thank you.
Thank you so much, Dr. Rishikesh, for joining us for this conversation and sharing this very important information with all of us. Thank you very much, Priyanka, also. You're truly an inspiration to all of us, and more power to you. On behalf of Apollo, I wish you the very best in your life and the courage to surmount all difficulties. A big thank you to our audience for tuning in and making us grow to such large numbers. If you need any professional help, you can reach out to us through the details mentioned below or through our social media handles. We are also streaming this session as a podcast by the name Hello Apollo on Spotify, iTunes, Google Podcast, and Amazon Music. To know more about healthcare and our upcoming episodes, do follow, subscribe, and share this message with your family, friends, and loved ones. We'll be back with another specialist discussing another interesting topic next week. For any queries regarding the topic discussed today, DM us on our social media handle Apollo Hospitals Delhi. We'll be happy to connect. Till then, stay happy and healthy. This is your host, Dr. Sushila, signing off.